has been an adventurous year. It has been very, very productive. Consistency really pays off. I am here to tell you guys that consistency pays off. Everything that we have been working for, I told you guys that in 2024 we were going to put it to the test. And I have been boots on the ground putting it to the test. All of my trainings, all of the knowledge that I have, all of my experience, all of my passion, everything that has to do with my purpose, I have been putting it to the test, and it is absolutely paying off. So make sure y'all drop those purple hearts, because your girl been behind the scenes working to bring these resources to you all and just do my part overall in making this world a better place than what it was when I came here in 1983. But we're going to get deeper into that later on. Tonight we have a new fighter on here. Are you ready, fighter? Let me get you on here, because our community is growing stronger and stronger every day. How are you this evening?
I am well. Can't complain. Can't complain.
Oh my God. Welcome.
Thank you so much for having me.
Welcome. I was so excited to meet you tonight. I think we scheduled before, right?
We did. And it was around Halloween. And I had my days crossed for an event we were doing at Insight Hospital and Medical Center. We had like a kids parade costume, boo bingo. It was a really fun time. And I thought it was on Halloween. So I went, oh, cool. I could do Wednesday. I could do Miss Monique's show. And then they were like, no, Dr. Shanté, it's Wednesday. Oh my God, I have to reschedule. So I'm just glad that we were able to connect and reschedule this, because this is so exciting. When my colleague introduced, your show, your network, she's like, you have to go on here, so you were very highly recommended. So I'm just happy to be here.
I love it. Well, thank you so much. It's always an honor when someone gives you your time. You understand what I'm saying?
Oh.
The thing in my life, I feel like family and time, that's what's the most important. So when someone chooses to spend their time with you, thank you so much. So before we get started, you let the fighters know who you are. Can we do the Fighters Pledge? Have you heard of the Fighters Pledge?
I have not. I'm here learning everything. I'm one of the new fighters. I'm happy to be here. So I'm here to learn. I'm here to take your lead here.
Okay. Danielle, how are you, love? How are you? One of our amazing fighters, Danielle. So the Fighters Pledge is something that I created. If you guys don't know anything about Micheline Monique, I want you to know the Fighters Pledge. It's everything Micheline Monique, but I wanted to resonate with you as well. So it's a tradition here that every new fighter takes the pledge. Just repeat after me.
All right.
I have a voice in this world and I deserve to be heard.
I have a voice in this world and I deserve to be heard.
I have an obligation to fight for all those around me.
I have an obligation to fight for all those around me.
But most importantly,
I
have an obligation to fight for myself.
I have an obligation to fight for myself.
I am officially a fighter.
I am officially a fighter.
Well, welcome to the fight, Dr. Shanté. Let the fighters know who you are.
Okay. Well, I am Dr. Shanté. I am a doctor of pharmacy. I'm also a doctor of naturopathy or naturopathic medicine. My day job, I'm currently the president of NCNM University. It was formerly known as the National College of Naturopathic Medicine, which is where I got my second medical discipline in. We are on the north side of Chicago at the moment, and we are branching out to the south side. So we're coming south because of a partnership that we have with Insight Hospital and Medical Center, because we're also a university and also a healthcare system. So when you think of places like University of Chicago, you can identify it as a university and a healthcare system. So we're the same thing, but we're the only one in town doing naturopathy or naturopathic medicine.
Okay. What's naturopathy?
Nephropathy is a natural medicine where we're able to help people relieve them of pain naturally without the use of medication or prescriptions, no injections, no surgery. We incorporate nutrition with our techniques and other modalities that we're using. The bougie term is connective tissue specialists. And because you have connective tissue throughout your entire body from head to toe, connective tissue are the ligaments that hold joints together, muscle to bone, uh, blood, lymph, the fascia network. We call that the white meat. It's right underneath the skin. Those are the connective tissues of the body that kind of help hold and keep things in place. And so we help to restore and correct those tissues when a disorder or some type of dysfunction occurs. And it usually manifests in some type of pain. So you're going to say, I hurt. I have a headache. I have a migraine. My shoulder hurt. My knees hurt. My butt hurt. My feet hurt. You're going to go, oh, I turned around to grab something out the back seat and my back went out. And that's how people present. But by definition, that is a connective tissue disorder. And what I've done in my work with the school, and not only the school, but the National Association, which is the American Naturopathic Association, is to create more widespread awareness of this field. We're celebrating over 100 years of existence, and we just need people to know we're here and that we're able to work within the healthcare model. So we're not an alternative medicine, we're a complementary medicine. We work well with every medicine on the planet. And so that's what that's been my passion for the last probably decade now, of creating more widespread awareness of the field. Most people ask, well, if you were a pharmacist, and I worked for the Walgreens Corporation for over 17 years, they ask, well, how did you get into that field? I already know that question is coming because it sounds like they're on two separate sides of the spectrum, pharmacy and then natural medicine.
Yeah.
And one thing that I will add about nephropathy is that it's not to be confused with natural medicine, which is the naturopath. So that's a separate practitioner. The naturopath is a practitioner. The napropath is a separate practitioner. We're cousins because we're both in the field in the realm of natural medicine, but because we are physical medicine first and foremost, we're touching you. So we're doing something manually to your body. So that's the biggest thing that is the key difference between us and our cousin, the naturopath. Most people hear napropath, they think naturopath. And that's because they're a little bit more well known.
Spell it for me, doctor.
Sure. N-A-P. Oh, let me put in, it's weird. N-A-P-R-A-P-A-T-H. I'm going to throw it on in the chat. Napropath, nephropathy is the field, or naturopathic medicine. We use those terms interchangeably.
Okay.
Yeah. So people, and that is how I found this place. I wanted to go into natural medicine. I wanted to learn something. And this school, the National College of Naturopathic Medicine, came up on, this is over 10 years ago. And I said, wow, it's not spelled right. Something's different here. What is this? And I went to their website. I realized they were here in Chicago. And I had met a young lady too that was becoming a napropath or doctor of nephropathy. And she just had so many great things to say about it. I'm still skeptical. I don't really know what's happening here, but I learned through their website that it was very heavy in nutrition. And that's what I was interested in. So all I wanted to do was take a nutrition class and add that to what I did as a pharmacist, because I worked in the retail setting. And I just wanted to be able to counsel people on their medication and be able to give them food options and things that, to balance it out. That's really what my motivation was at first, until I got an injury. I got a frozen shoulder and I couldn't raise my arm this high. I couldn't raise it without excruciating pain. I mean, how many of us have that story where some type of injury, something, and it just changed your quality of life? It's, so I just had to go to work in pain, because here I am. I did not want my body cut. I was not going to have surgery, because there's only two things that were offered to me at this time: surgery and medication. I did not want to go under the knife, not at my shoulder. I just didn't want to do that. I certainly was not going to take a narcotic or a painkiller because I'm the pharmacist. I have the narcotics key in my pocket, which means I have access. So I was terrified of that. And they kind of scared us to death in pharmacy school about those pharmacists where when something happened and they got addicted to drugs, and we all are familiar with the opioid crisis, right?
Yeah.
So
Yeah.
I just didn't want that for my life. So I went to work in pain, but I didn't realize the jewel of the place that I was in. And one day I was in class writing notes, cringing in pain. And the teacher for the night was also a technique instructor. And he
Okay.
said, Shanté, are you in pain? I was like, yeah, my shoulder, it hurts. He took me to the back of the class, put me on the table. Some of my other classmates, they were in his technique class. And so I became the guinea pig that night. We were supposed to be talking about probably some macronutrients, but because I was in pain, it was a teachable moment. And
Yeah.
so he had me on the table. He was doing some things to my arm. And when I sat up, he didn't give me a treatment or do a full thing, but he was assessing what was happening and trying to give me a little relief as, you know. But all I remember is when I sat up, something felt different that I hadn't felt in weeks. And I turned to him and I said, where is your office? I will pay you cash if you can fix this. So I scheduled an appointment. He treated me. And mind you, I have never really had any experience. So I never went to a chiropractor before. I've never had one to a physical therapist. Maybe I had a massage, you know, here and there. Never been to an acupuncturist. Never been to any other type of pain relief specialist that we know pretty much from around, right?
Mhm.
So I went to him and I didn't really know what to expect. He treated me. He put this kinesio tape on my shoulder, you know, and it was like a hot pink color. I remember this distinctively. And it was in the month of November. So this is very sentimental right now because it was in the month of November. I remember this because a really good friend of mine had a birthday party that weekend. And I was just so sad because I didn't think I would be able to go because I was in so much pain. But I was able to get into his office and he treated me. And when I tell you that pain, that was on that weekend, I was in the club with that kinesio tape on my shoulder. When was that injury? 2010. Never had a problem since. And
Mhm.
that was enough for me to say, what is this?
Yeah.
I need to know a little bit more about it. I have plenty of stories during my childbearing years and where it helped me out when I was in a lot of pain, when I was
Mhm.
pregnant. And I have plenty of stories. But it really, in so many ways, it saved my life, this field, and it also gave it more purpose for me, you know. So I'm very passionate about this medicine and the future and recruiting students into the field and exposing more people and patients to the field to know that this is an option for them, that you can choose this if you want. So I've been advocating for it for the last 10 years minimally, you know, through the association and so, you know, and just through my rise to the helm of the education, you know. So I'm really excited about the future and where we go from here. And that's part of my story.
I'm so excited and thank you so much. Thank you so much for the work that you do. And it's so funny when I started my podcast, I prayed for divine connections, right?
Mm,
One thing that you hear me say is no medicine. I tell
mm.
everybody, no medicine. Don't give me, I don't want to be doped up on these opioids. Like you said, if something happens to me, I want natural cures. So I want to know more. I, I want
Oh, we got more. We got
I
more.
want to know more. When my mother was passing away, one of the things that she dealt with, it was excruciating pain. So our day would go like for uh maybe like 12 a.m. until 6:30 a.m. she was screaming. It took us like almost 8 hours to calm her down. And when we finally calmed her down is when we got her to go to sleep. So the medicine had kicked in. But anytime she was aware, she was awake, excruciating pain. And they gave her this medicine. I can't think of what the name is. I'm going to ask my sister. They give it to everybody that has like nerve pains. I know you know what it is. It's very common. What do
Mhm.
they prescribe for nerve pain?
Well, a lot of times, sometimes what I do remember, and being in that industry, Neurontin was a very common one. That was the trade name. Gabapentin was the
Gabapentin.
name. That was
Gaba-
one of the ones. Hmm.
it was gabapentin.
Okay.
Um, I wouldn't recommend anybody being on gabapentin. It didn't do anything. The only thing that they did was continue to add to the dosage,
Mm-hmm.
and adding to the dosage caused her to lose her cognitive ability. It
Yes.
never
Yes.
stopped the pain.
Yes. Yes. The with those type of agents that work on the central nervous system, it's most of them are really designed to alter our perception of the pain, to give some relief. And it does, it's not lasting. It's not meant to be the be all end all. And that is something we even learned during pharmacy school, that, hey, this should be something that's a bridge to health. And I understand there's a lot of people that have a sentiment towards medication, and I like to just tell, shout out to the pharmacists out there, that pharmacy is not pharmaceutical. They're very similar in words, but the practice of pharmacy is not what people may think, because one, we don't even have prescribing authority, so we can't even push it on you. We're typically the gatekeepers in that sense. But any pharmacist would always say, hey, that's really going to be something that's a bridge over to something else.
So pharmacy is just the distribution.
Pharmaceutical is probably the distribution, but pharmacy, just a general term, is just the field of the practice of pharmacy. Pharmacists are the practitioner to the field.
So when I say distribution, is it meaning the pharmacy will be the one that would administer it to the community? Is that what you mean?
Well, we do dispense it to the community, but as far as mass distribution, we get them from pharmaceutical companies. So that's where that's coming from. And then the distribution, of course, through community retail pharmacies, inpatient, outpatient, hospital pharmacies, or independent pharmacies. There are some that are just standalone, that are not part of any chain of pharmacies, where you're able to go and get the things that you need.
Okay.
Yeah, so I like to go the extra mile to make sure people know, like, this not the same thing, because and I probably have conditioned myself to do that, because in the natural community, they may not realize this, but they could be drug bashers, and there are medications out there to really save lives. It is the abuse of medication sometimes, whereas you have a lot of these adverse outcomes. And then in the case of, like, with your mom, where something legitimately is going on in her body, and it's just not being a medication that can help to assist with that, properly. And that's a lot of people's stories, especially if they have some type of inflammatory pain, things like fibromyalgia, where their body feels like it's on fire, and it's, the nerves and everything is, that nerve pain isn't something I've dealt with. Sciatica before, personally. I know that most of these things are.
Go ahead. I'm sorry.
From repetition, usually our posture plays a role in that. When we don't have proper posture, rather we're in a closed environment. And what I mean by a closed environment is sitting in a car, sitting in an airplane, in a truck. I think of truck drivers, I think of bus drivers, people who are that are driving for extended. That's a closed environment, and we're not designed to be like in that. Those positions were designed to move, because movement is life, so when that happens, muscles have memory and things happen. Sometimes we're not sleeping properly, so it's the posture. And that over time, it took a while for my frozen shoulder. And when people go, well, what could have caused it? Well, I know now what did. Repetitive motion from working so many years as a pharmacist, standing on my feet on the phone with my ear to shoulder, typing, ringing out prescriptions, writing prescriptions, and it locked up. I got a headset after that. I demanded a headset after that, because I did not want that to happen to me again. But that was some of the things that, being in the pharmacy and seeing people legitimately in pain. That was one of the things too that made me go, man, there has to be something else out there to help people. We have great medications for a lot of different things, But when it came to that pain conversation,
Mm-hmm.
it's not, it does what it do, but it's not meant to be long term, because even if you use something that's not necessarily a narcotic or one of our controlled substances like medications, you're not supposed to be on it because of the psychological and physical dependency that it can create. So even if you go to a lower level, like a non-steroidal anti-inflammatory drug, we call those NSAIDs. Those are the ibuprofens and the leaves, and but then that's going to have some effect on the stomach, and the lining, the protective lining of the stomach.
Mm-hmm.
So long-term use of these things has these adverse effects, and that's just the way it is with medications. They're not natural; they're synthetic, which means that they may go in to go do a certain mechanism of action, but they're throwing off other systems of the body, and we have to manage that and watch that with our patients. So that pain conversation, even with pregnant women, I used to break my heart when they will come up and they have a headache, or they have some back pain, or they can't help what's happening to their body. It's inevitable. They're carrying to have a child, so they're legitimately in pain. Most of the medications on the market are going to have some effect on mom and baby, so they're not always safe for them to take, especially after the first trimester. And so what do you do, for them, and it was those type of scenarios when I would be in the pharmacy working, not the people who were abusing the drugs, but the people who were legitimately in pain. You could see it in their face. And that used to always break my heart. So I always wanted to know is there anything else out there that's working? Because we've always known about these other practitioners. But when you think about the money that this country spends on chronic pain, that number is just going up and up and up and up and up. And what I would say, and I am biased in saying this, I would also say that is because they don't know that nephropathy exists. That is something that could be used as an option to help relieve some of that. Now, I'm not saying it's a cure. There are cases where people can come in and we are able to alleviate their pain. And then there are times where we actually got to see you a couple of visits, to walk you back to health because you didn't get where you got overnight. So it really just depends. And then sometimes sometimes we can't prevent that surgery. So sometimes we have to refer you to that orthopedic surgeon. If the ball is falling out the socket,
right,
there's no amount of herbs or praying you need intervention. Okay. So that's, a lot of times you tear something, one of those ligaments that hold that knee cap together. Let's go get
the
that.
sea moss ain't gonna get it back
like there's a practical approach to this, and I want people to be realistic. When you live eating the standard American diet and then you're looking for the natural medicine to be the cure, all lickety split, you want that magic pill. It doesn't exist. It really doesn't. And it's really us having to put in the work and to do the work and to discipline ourselves as well. So nutrition is a really big conversation that we have with all of our patients. So nephropathy is something that's not just helping to help you with it on the outside, but also within, because of the intervention that we're going to do with you nutritionally, where you're able to help heal both inside and out, with the same person. And so it's been very rewarding. I have so many great stories. I don't treat as much these days, maybe friends and family when they really need it, but not the patients, because now I'm in administration. I'm the president of the college. I'm teaching classes. I'm also teaching pharmacology for complementary medicine so that they can understand, becoming that bridge between our world and the other so that there's understanding and compassion on both sides. Because medical doctors or allopathic medicine isn't there to hurt people, but when it doesn't help, there should be a way for people to transition to something else that could be helpful. And that has always been my belief, that, hey, if you're having an asthma attack, take a puff of that albuterol inhaler, and then we'll do something natural tomorrow. But don't let your airways close up and die because you just don't want to take that drug. So that's my approach, when it comes to, integrative medicine, for me personally.
I love that. I love that. You are definitely needed. Thank you so much for the education
Oh,
because
no problem. I didn't mean to get preachy over here. I was like, wait a minute, we're not
I,
in class.
I got more questions. We're here now.
I'm like, oh no, we're in class right now. Everyone's in session right now. Like, there's no
Because
quiz though. For
I,
those who are watching, there will be no quiz.
I'm telling you, I just turned 40 and I've been taking it very, very serious
Yeah.
because I do work in the hospital and I
Mhm.
see people being medicated and I see how it's just, it doesn't seem like it's doing any good.
Hmm.
It doesn't seem like it's doing any good. And then, like I said, well, my experience with my mother, I
Yes.
don't, I just, she was on one medication that was for AFib. The
Okay.
AFib caused the problem with the blood pressure. The
Mm.
blood pressure medicine caused the AFib. So the
Mm.
AFib triggers the blood pressure, and the blood pressure triggers the AFib, and it's like a seesaw. And I was sitting there like, it has to be something.
Yes.
So
Yeah.
how do you approach that when you know, do you take one thing at a time and tackle that? So like say she had the high blood pressure. Will we start working on that and keep her on the AFib medicine or how would does that make sense? Is that a good
Yeah.
question?
That's a very tricky one here. And the reason why is because, the AFib, that has to do with the rhythm of the heart. There's a rhythm.
Mhm.
Dum dum dum. We look at that EKG and it goes up, and those are the contractions because the heart is a muscle. Okay, so those are the contractions of the front, the top, which are the atria, and then the ventricles, and it has to go in a rhythm. And when it's not moving the way that it should, it's throwing things off because, of course, you need that to pump that blood, the oxygenated blood that's come from the lungs now, to pump it out of the aorta, goes out into the peripheral, right? The periphery, I'm sorry, goes to all the tissues of the body. It has to be strong enough to do that. So if the rhythm is off, it's going to affect just being able to have that blood distributed throughout the body to all of the extremities, because blood carries two very important things: oxygen and nutrients.
Okay.
And so if there's a problem there where the heart rhythm isn't strong enough and it's not, and it's messing up, that it's not getting it out there, well, now we're going to have to do something else too, because what's going to happen is kind of like because the body is always trying to correct itself. It's going to try to preserve you. So,
Yeah.
but your blood pressure has to be at a certain level, for things also to get where it needs to be.
For
So
the
if
body
it's
to be
coming
working.
out a certain way, then there are going to be things that's going to happen on the outside that's, wait a minute, this isn't moving the way it's going to. So maybe the vessels are going to constrict a little bit more because it's trying to get that blood pressure to be at a normal range that's adequate just to be able to I'm losing a word and I'm looking up for, just to get to all of the tissues.
Mhm.
And so that's tricky with that situation of the irregular heartbeat, which is what AFib is, at simplest term, an irregular heartbeat, and then trying to have that normalized blood pressure so that all tissues of the body are receiving that. Because if it doesn't, then it'll die.
Mhm.
Those die if they're not getting the oxygen or the nutrients, and they're not going to be able to do what it needs to be done. So there's so many moving parts when it comes to that. My mom has had some hard things that, that's been done to her. And even against me not wanting her to have that or do it, certain interventions that has gone in,
Mhm.
to do it. But it's all in the interest of getting a regular heart rhythm, so that's the thing that's really tricky, when they get to those stages.
When it
Um,
gets to the heart.
Yeah, when it gets to those stages where you have multiple and what they call it, comorbidities, you have different things going on, and a lot of them are uh, prerequisites, for lack of a better way of saying it, to one another. So it's
Yeah.
almost like you can always tell that someone has a circulation issue, that
Mhm.
there's maybe some heart issue, maybe there's, which then now I'm thinking about the circulation, I'm thinking about the blood itself, the texture of the blood. Now I'm thinking, is something going on? Is there diabetes? Is it cholesterol? And like what's happening, inside of the body with those things,
Mm.
and I mean, like with the pain that you said your mom was having, depending on where that pain originated, why they were giving her for the nerve pain, like was there a particular part of the body, or was it all over the body?
She has surgery on her stomach,
Hmm.
and it went septic. I think
Okay.
that's what it is. So it was pain everywhere. Everywhere.
Okay, so that's something. So all of, because I was wondering if it was localized, or so they had to do something centrally acting to try to help her, just based on how she presented. And then
Mm,
again, depending on, like, what I remember with my dad, before he passed, he had so many systems that were failing,
yeah.
like right after, and it was like, oh my God, like there was no way for me to go in with the natural result at the stage, I should say, that he was in. Like, had I known it 6 months earlier or something, to that, then yes, I'd been able to try to help walk on back into health. But those are the type of stories, those are the things that motivated me to keep going in this field and being able to find more answers, coming back into our communities, being able to educate people about it. And that nutrition conversation is a real conversation. I'm definitely going to ruffle some feathers here, because we have a holiday that's coming up that is the culprit of a lot of the disorders and ailments that we face in our community, specifically because of our culture. That soul food that we love so much, that has no nutritional value. I don't care what it is, has no nutritional value. Say that one more time.
It just tastes good.
No nutritional value. That is it. So what I do, I have a habit, a little practice that I do for Thanksgiving. I make sure that I eat a raw salad, fresh fruit that morning just before, because I'm going to go back. I am going to have some dressing, y'all. Don't get it twisted. I'm just not taking any plates home, because it can't be a consistent, because I know I want to be able to still. So this is my rationalization. Hear me out. This is why I do this. I still want to partake in what I grew up on and what we know, but I also know too much. And I'm like, oh, this is hard.
Yeah.
Okay. If you do this, Shanté, if you do this, if you do this, what it's doing.
The outcome.
So what I do is I make sure that I do things in the beginning of the day. And then at the end of the day, I go and I partake in everything, but I make sure, and I do preach this and recommend this to people, make sure that you give the body what it needs first. Those prayers we do over that food is not giving it any more nutritional value than we hoped. And them hands that we blessed for preparing said food. It just...
What's the
I know I'm gonna ruffle some feathers when I say this stuff, because we get up there and I try not to laugh when we all hold hands and they let bless this food that we about to receive and for the nourishment of our bodies. And I'm like, there is no nutrients. There are no nutrients. Now, if y'all want to take one of these multivitamins that I got in my purse afterwards, then you're going to get a... Right. Bless the food, Lord. Exactly, Miss Sheena. So, this is real. Something that, and I still struggle even with my own family, having that conversation with them about what they put in their mouth.
Yeah.
That, hey, that is what's going to lead you to where we're headed. People say, oh, this runs in my family, and no bad habits run in our family.
Right. That's right.
And we are predisposed to the things that our parents have had. We are predisposed to that. So both my mom and father had high blood pressure and things like that. But I don't live the same lifestyle or have the same diet that they did. I had to deviate away from that so that I'm not someone that's over here taking a high blood pressure medication. I'm already predisposed to it because I come from them. So yes, there's a genetic component, but we don't have to activate that gene by way of a bad diet, so we're able to do that, do something a little bit different by having an anti-inflammatory diet.
That's right. You can choose.
Yeah, we choose this, so I choose not to eat pork. I choose not to eat these things. And I also choose my poisons, meaning that if I know, I'm like, this isn't something that's going to work. But if I do, and I even teach my son, and I also encourage everyone, start with your little ones, teach them early so that they know. My son knows that if he eats pizza and dairy and all that other stuff, expect mucus buildup. Expect that you got extra mucus coming out of your eyes in the morning and around your mouth, and extra because your body is trying to get rid of it. The only thing natural to the human body is water. Food has to be broken down into an absorbable component where the body can use. So it's not natural. Water is though. And so I try to teach my son that, like, do not drink that cow's milk, do not grab them cartons of milk that they put down our kids' throats, our baby's throat. I just cringe at it, but I don't control local school board systems to say, hey, that's really not the best option. Give them a juice or something, give them some water or something, maybe a juice that's not made from concentrate. Give them a better organic option than that milk carton. Because we're feeding our babies inflammation. And then they're the ones, and I know this because in the years that I was dispensing, it was children that were on the albuterols, the nebulizers, because they're developing those cold-like symptoms. That's not quite a cold, but you hear them wheezing. You hear it in their chest. You hear the runny noses and the congestion, the things that's happening by way of the dairy. And that's the honest to goodness truth. That's what's causing that to happen. And it's activating your immune system. So the more you are triggering your immune system, because your immune system is there to protect you. It's like the machines off of the Matrix. Mm-hmm. Search and destroy. That's what it's supposed to do. If it's not you, they're killing it. That's what it's supposed to do. Mm-hmm. But just think about it. If you think about it like an army that you activate at will, they do get tired, and if you're not feeding it the things that it needs to keep protecting you, and you're constantly causing that system to turn on, then now that's when we in this new little label that they call autoimmune disorders, because your immune system never turned off because we kept introducing something by way of what we're eating into our system, and it kept triggering it. And that's what's leading to, because it needs to shut off. The inflammation process, it was designed to be a healthy process. It's not supposed to be on all the time, because too much of anything is going to be bad for us. Too much water can kill you. So same thing there. But we weren't properly educated as far as nutrition wise, what those things are. And what I will say to people listening, like, well, how can I know what I'm allergic to? An allergen test will tell you, what foods work with you. There's a book that I have lived by, Eat Right for Your Blood Type. I'm O positive, and I go by the O positive diet. And I take heed to some of the things that are said in that book. I may not care to use their recipes, that they had there, because I like my seasonings. But I do utilize some of that, and I help. I'll give you an example. It had in the book that echinacea was something that could weaken the immune system of the O positive person. And when you think about when you get a cold, the flu, COVID, that's part of that, right? So when you think about it, like I used to always, and then it also said oranges was another thing. And I didn't know this. Oranges was a fruit that acted as something not good for my immune system, right? For my blood type. And so I used to always just have drink the orange juice, take the echinacea, and wonder why I was sick for longer periods of time. When I switched up the herb by their recommendation and went to elderberry, something that would be much more compatible, and mixed the oranges in the orange juice and other immune stimulants that were agreeable with me. Well, now I don't really get sick much at all, because I have a practice now of making sure. But if I just forgot my supplements, or I wasn't getting enough rest, and I still got introduced to a bug, I knew what to do, and I wouldn't be down as long.
So it's so funny that you say that about the orange juice because we got the same blood type. Orange juice never sat well with me. It never sat well with me. I never knew
Hmm.
why. I don't even know if that is the reason why, but I'm also anemic. And so they always want me to take iron supplements with the orange juice. And it could be that's why things are not working because the oranges are bad for me. I just learned about eating according to my blood type. I just went to an event about that probably
Oh,
about 3 months ago. About three
okay.
months ago, if that. And I said, why isn't this information given out to more people?
I know.
If we can just change up simple things that we are eating to preserve our lives, it'll make all the difference.
Mhm.
Let's get
Mhm.
to some of these comments.
Okay, we got some stuff. Okay, we got some people. Okay.
Gregory said, "Hey fighter, thank you for those purple hearts." He said AO scan can tell you in seconds. He's talking about what's wrong with you. And Sheena said earlier, we were in our conversation, we were
All
talking
right.
about eating. She said, speaking to the opioid crisis, I'm curious to know why are the doctors constantly giving their patients opioids for very long periods of time, sometimes years? Is there something in place to prevent the addiction to this medication? I love that. I work in mental health and they talk about drug addictions very heavily.
Yes, because those controlled substances, as I mentioned before, have very high, moderate to high psychological and
Mhm,
physical dependence.
mhm,
And that is dealing with certainly the nervous system. You know, when like we have natural endorphins and things that make us excited, things that make us happy, things that make us, we
mhm,
that has that naturally, right?
mhm,
And it's hitting the receptor sites on the other side of that nerve ending. And on the other end, it's going to go do something, right? So you think about leaving one space, leaving one side, going into a space, hitting a receptor. That receptor picks it up, and then it goes down that nerve ending to go do whatever it's supposed to do. Maybe it's going to excite something or it's going to inhibit something, right? So when it comes to the opioids and things, when they're competing to hit those receptor sites, they're competing with the natural things. But when they hit them, because they're synthetic and they have a bigger power punch, we feel that euphoria. We feel it comes over us like, oh my God. And we're always looking for that first high, for lack of a better way. So because you never quite get it again,
yeah.
even if you're taking it and taking it, over and over and over again. Now, the reason that they do it is because that is what they're taught. That is what they know. And that's why I said, hey, cut the MDs some slack. Some of them are just writing it because people are getting on their nerves and like, I need it, I need it, I need it. But some, like, really, that's all they know. And if they had known about the naturopath or that practitioner, then they would say, hey, take this for a couple of weeks. Because I would say in acute situations, acute pain, then they're effective. Chronically and over time, probably not the best option because of the dependence that the body is going to be, develop. And then it develops tolerance. So once you get a certain dose and level, now your body then got used to it. And they're like, okay, and so now they got to up the ante. They got to increase the dose for you to, um,
So how do we help with that? Can we do that naturally with removing people? How do we?
depending on what it is.
Okay.
Again, I am biased in saying this, but I would say find a naturopath and get an assessment,
Mhm.
because there are situations, again, where, hey, you're going to need to do this. Sometimes, and even in the things that when we're treating you, it's okay to maybe take that, something, a non-threatening pain pill, just for the symptomatic relief, so that you can rest, so that you can, but after you've gotten a treatment from us, now you wake up from everything and your body is actually better. Because regardless, like, of the fact of all these great supplements, people say, oh, I rubbed some of this oil on here and it went away. Listen, I've never seen a pill move a bone.
That's right.
So someone still has to go in, and it's a connective tissue disorder. Something is off. So we still got to go and correct that thing. So even if you want to take the medication or the pain relief medication for a symptomatic relief to give your body time to kind of mellow out to the treatment, that's cool too. Like, hey, I'm all for it. If you listen, it's about comfort and having that rest. So let's see here. Okay. Here's some like food for energy.
Oh, were you still reading it? I'm sorry.
I was just reading some of the things that, so yes, that's, and again, that, just to the point of that comment that just came on the screen, that yes, it's for symptomatic relief, but even if you are taking something for symptomatic relief, it's important to still have something manually done that's going to actually hit the root cause of why that's the way that it is.
But even once they get it, say if they have to have a surgery or something like that for pain management, is it something that you would prescribe as an alternative? Because I don't want to take any medicines for anything. Or is it because we had to go surgical, we have to do that at first?
If you want to listen, honey, after that C-section, yes, give me that, what y'all talking about over there. You know what I mean? Like I'll after a couple days, I'm gonna go on and do my thing, later, and just deal with the pain. We just deal with the pain because that's tissue repair. Now there's a scar tissue is being formed, usually after a surgery or something like that. And that is what we really do work with people, because we're working, helping to stretch it and to make sure that you're still mobile, increasing. So what we do is in our methods of helping to reduce that pain, we're going to increase range of motion. We're going to increase circulation, which also helps to contribute to decreasing those pain signals. So we got to put the body in alignment. We correct the spine. We correct other tissues like nerve and muscle tissues by way of some other connective tissue manipulation that we do on the body. Encouraging people to drink more water, and taking other supplements that's going to help in tissue recovery. So there is a part of rehabilitation. So say we weren't able to help prevent someone to get a surgery and they went and did that surgery, they can come back to us and we'll help rehab them.
Okay.
So their tissues are healing properly, and that they're, so we're able to help them in that way too. So I already know, for those that are going to say, oh, she's just saying that because she is a naturopath. I know. That's why I'm saying my answer is a biased answer. However, you can definitely, I would utilize both of those, because I'm also a hybrid. I believe in integrative medicine. I don't believe in one or the other personally. But there are some that may have their preference, and it really just depends on the patient and what they want for their care. And that's the first question I ask. How do you want this to go?
Okay.
Not what other people think, not what this study said. Like I start, because you are also your own best doctor.
That's
because
right.
I have to get you to comply. So you have to be in agreement to what I'm suggesting to do. Otherwise, you're not going to do it.
And you know what works. You know what's making you
for you. So we really want to empower people to be advocates for their own health, and have that courage to have those conversations with those medical doctors and say, no, I don't want it. A lot of times they're doing it and a doctor think they're doing it, and the person, they're not doing it because they never said to them, no, I want this as part of my care. We're here to advise and assist, but we're not here to make those decisions for patients. You're there to make that decision, but we're here to give you your options. And and that's something that I do both as a pharmacist and a naturopath. I provide people with the options. Hey, how do you want this to go? This is going to do this. This is going to do ABC. This is going to do XYZ.
That's right.
Which route, how do you want this to go? And then just work with them that way. And we usually have and I've had some really great outcomes from patients when they are a part of that care.
Gregory said naturopath medicine came before Western medicine.
Mhm.
I agree. I love this information because I'm telling you guys that I am wholeheartedly, I don't want no medicine. I do not want any medicine. I am the person, I believe in integrative medicine, like you said, once it goes so far. But all of my life, even when I was a little girl, as
Yeah.
soon as the symptoms start to ease up, I no longer take the medicine. I've
Yeah.
always been that person. I'm not gonna keep on doing this. I ain't gonna keep taking this medicine. And I'm starting to find out that it actually works. That's a good thing.
Yeah.
That's a good thing, right? What do we do for preventative measures? Because we talk, we've given them some scenarios and things like that, but let's get proactive before it goes bad. What do
Mm.
we do? We talked about eating for our blood type, right?
Hmm.
And
That's one resource that I would recommend for people. These are the things I always tell people. I always start with the water conversation. Half your body's weight in fluid ounces. Why are we saying that? Because we want to make sure that all of the tissues are adequately hydrated. Because in the water that you drink, that you consume, your brain is going to take majority of it, and it's going to ration it out to the other organs and organ systems. But it has to survive, so it's going to take the bulk of it. So if you drink enough, then now you can make sure that your entire body is adequately hydrated. So I always start with the water. That's something I just give away for free to people. Half your body's weight in fluid ounces. If you stand on a scale and you're 150 pounds, then that means you need to be drinking 75 fluid ounces
okay.
daily. And that number is going to change because our weight changes, right? So it's not written in stone. you know just like blood pressure, it moves. It's not something that's just static. So certainly being in tune with your body. And then if you are maintaining a certain weight, then you know how much water, and you'll be able to tell based on if you're losing any weight or gaining any weight, or so yeah, that's what I would recommend first. I also always recommend taking a multivitamin, a vitamin from A to zinc, meaning it has vitamin A on that list all the way down the line to zinc at the bottom. So from A to zinc and everything in between, a
So if
multivitamin.
we know, so here's the thing. That's why it's hard for me to take supplements because we have so many that are not really natural. So now let's talk about, everybody says that you need this multivitamin. We have so many options of multivitamin. How do we know what to choose?
That is so true. That is a
Because
very good, and it's a good question, because the supplement industry is just booming. And one of the things that I've done over the years is there are certain companies that are vetted, that I've vetted, and I've done micronutrient tests with patients in the past to see where their nutrient levels are. And I may have introduced a supplement from a certain brand, and then 6 months later test them to see. So most of the places, or I take them myself and give them to my son and my mom, and I know how I feel when I'm taking them and when I'm not taking them, what happens in my body. I'm no, you bend over and you hear them knees crack. We need some more water, and we need some more nutrients that's going to help to produce the fluid that's needed as that cushion in between the joints.
so
So
talking about so talking about fluids, another thing that I just learned a few weeks ago. So talking about hydrating the body, right? And we talk about fluids and stuff like that. So do you recommend, what is it, omega-3? Do you know
well,
about
that was I was going to get to that next, as part of the macronutrients.
okay.
And in nutrition, you learn that your macronutrients are your carbohydrates, your fatty acids, and your proteins.
Okay.
That's just something that's commonly known, right?
Mhm.
Your fatty acids, I would always recommend that be an omega-3 supplement.
Why omega-3?
Oh, well, that is the one. That is the because that is the one that once it goes into the body, it's helping to produce the different lipids. It also helps to produce omega-6 and 9 in certain reactions. But that is the fatty acid, the fatty acid
This,
that you're taking, because you do hear about 6 and 9. but those are developed after it needs the 3 to even for those to be, and you don't even have to really take the 6 and the 9, because your body would do that. But let's say a person presents deficient. Let's say they do, and they're like, hey, take the 3, 6, and 9. Okay. But really, after you do that, really all you need is the 3. That is the one. That's the main, one that you need.
And the reason why you really need the 3, we need to get out of here. We're going to have to do a part 2 to this. People need this.
But let me get to at least the other part as far as when we think of carbohydrates. We want to make sure that we're talking about natural sugars. We want to make sure that we're talking about natural sugars and not synthetic sugar.
How do we know the difference?
Natural sugars would be your fruits.
Okay.
That would be your fruits. Because people hear carbs, we definitely have to. This is going to have to be another carb. We're going to have to come back for that, because I really want to talk about that, because I want to talk about good fats and bad fats. Because some people will avoid fats altogether, but we need fats. That's part of the whole thing as far as what the body needs to just function. And then with protein, it's really the amino acids that we need. You know what I mean? It's what the body is breaking that protein down to consume. It's trying to extract something. So so yeah, that is, we'll be on another 3 hours. I have to do a nutrition course, so I definitely want to come back, but I want to at least leave this with people: half your body's weight and fluid ounces of water every single day. Okay. Good multivitamin. And, and if they follow me, I have recommended brands, like different places that have done well with patients, so like I'm not a free.
What's your website? Let me put it up there.
Sure. On ShantéBeauty.com.
On Shanté?
I'll actually put it in the chat for you guys. ShantéBeauty.com is where my online store is, and I recommend supplements. So women's health, I have categories there, and I have, because they're different brands. So it may be this person brand or that person brand that has done very well in the past with other patients. There's some places where I may send a person to a website and be like, hey, they're really good for this thing. So I like to be able to provide options to people for select supplements. And if people want to book any type of consultations or something like that, I'm available for that. Just a flat fee for that, to just sit down and let's go over things and talk about your status and what you want to do just to get back healthy. Then we dig into the actual diet, what you're eating, how you're preparing it, all those type of things, So, but, just first things first. We'll start with just, hey, that good multivitamin from A to zinc, an omega-3 supplement, an antioxidant, and then that water. We'll start there. And, and then some digestive enzymes, prebiotics, gut health. I have to get the gastrointestinal system together first before we can really jump into whatever your real issue is, because the only way for you to adequately absorb that is that system has to be working. So I'm going to probably recommend a detox, cleansing it out first, so that, hey, when I start putting this good stuff in, that you're actually absorbing it and it's going and doing what it's supposed to do in the body. So we start there with those type of courses, but I can connect with you offline, and certainly, like different programs and systems and things that I've put in place for people just to help guide them through the process. And then they do it at their own pace, because this is it. Listen, we're addicted to sugar and salt, the world. Okay. It ain't just drugs. And you have to detox from those things by way of the foods that we've eaten, the preservatives, all the things that's added in the foods today. We do have to detox, from
we definitely do. Let's get this last question before we get up out of here. Shayna said, what are the supplements to prevent cold and sickness besides the elderberry for the type O blood?
Vitamin C.
Vitamin C.
Yes. Vitamin C is a good one. Vitamin D as well. But it's the way it's dosed. There are things called loading doses, where you hit a power punch of it, and it does something, and then we kind of taper you down to what a regular daily dose would be. So it's a method to the madness.
It
To get
is.
you where you need to be, especially if you're malnourished already. And if you're presenting with something, then that's already telling me. If you're on a medication or you're presenting with some pain or something's wrong or something's happening, then that's already telling me the story that hey, you're malnourished. Where we start, I'm going to start with an approach that's going to help every system of the body and not just one thing in particular. So that's how I would approach it.
I love it. Hey, we gotta definitely do this again. This is
Yes.
so informative. We really appreciate you. You guys make sure that you are following Dr. Shanté. Reach out to her, get this information, book a consultation, because she has a lot for you to preserve your life. We need to start taking this stuff serious.
And I'll put my what do you call that thing? Your thing. So I'm at Dr. Shanté RX everywhere: Facebook, Instagram, TikTok, YouTube, LinkedIn, Snapchat, wherever. That is how you find me, at Dr. Shanté RX.
I love it.
Yes, thank you all.
Thank you so much. And as always, guys, you will catch us on Facebook, YouTube, and Instagram Live Wednesdays at 7 p.m. Central. Head on over to the Block 105 Radio and SoCal Radio on Saturdays at 1 p.m. Central. And whoever caught this, whoever catches the replay, whoever attended the live, we really pray that this resonates. Make sure that you are sharing this out, because this is some vital information. I love you guys. Bye-bye.
Bye.
Miss Aline Monique's book invites readers on an inspirational journey through 40 carefully chosen quotes that shaped her success. Beyond mere words, these quotes serve as beacons of motivation, illuminating her path during time of uncertainty. Monique shares personal reflections, exploring how each quote became a guiding principle, influencing her mindset and propelling her toward achievement. In this collection, she prompts reflection on readers' journeys, providing a captivating synergy of profound quotes and personal narrative, surpassing the constraints of the written word.